Supplementary outcomes then. So you're logged into your record of competence, supplementary outcomes, guidance, have a read through the guidance, and then you've got 9 that you need to complete. Now, pretty much, well, all of these except for 2 say can be done at any time. So first of all, 1 is just to upload a certificate for your ILS training, so your immediate life support training whenever you do that. 2 is just a list of the equipment that you use. The big equipment, you'll put the maintenance and service history. For smaller equipment, you just write what it is. That's all the equipment you use, so even things like cannulas and 5mm syringes, for example. Supplementary outcome 3 is just the emergency drugs that are used in the practice and what they're used for. Supplementary outcome 4, that's just a question where you read the national guidance. It gives you the link, or it's the IACSD guidance document that you have in your theory course as well. And you just answer some questions on that. Supplementary outcome 5, it gives you an ethical dilemma, and you just answer questions on that based on your experience. Supplementary outcome 6 is a short audit. Just go to that quickly. So it tells you what you can use for your audit topics and what an audit is. So we would like you to. And once you've done it, you just upload a copy of it. Essentially, an audit is where you pick a topic, you set a standard. For example, you want 100% of patients to be satisfied with treatment. You want 100% of the consent forms to be signed in the records. For example, you set a standard that you should be aspiring to, you should be achieving in practice. Then you carry out your audit. So you might select records randomly or send out patient questionnaires, collect your results, assess the results, and see whether your standards are met, then explain why they're not met, what actions you might take to improve in the future, and how often you would want to recheck or re-audit, so every 6 months or every year, for example. Supplementary outcome 7 is just listing the advantages and disadvantages of intravenous sedation and anxiety management. 8 is where you just reflect on your training experience and your sedation experience at the start of training and at the end. And then 9 is just a record of any extra CPD that you might have done, what should have been on this course.